Hello, everyone. Sorry to keep you waiting. I am Valentina. I'm the founder and CEO of Day. And today we're going to cover the gender health gap and how we can support women to be fully participating members in our societies and our economies by driving fundamental change through research and innovation. And my background is in medical device and public health, but most importantly, I suffered from a number of different gynecological health horror stories when I was growing up, which I thought was very unusual and rare. But then through conversations with my peers and my friends, I realized that the majority of women go through gynecological health horror stories. Due to the stigmatized nature of women's health still today, we largely keep these to ourselves. And as a result, we don't fully grasp the impact on our societies and our economies of poor women's health outcomes. And in brief, one term that we can all get familiar with in order to be fully aware of the problem is the gender health gap. So today I'm going to walk you through a few of the most prominent examples of the gender health gap, and most importantly, what we can do to address these gaps and to change the status quo. So as it stands today, modern medical science still understands very, very little about how to diagnose the female body and how to treat the female body. And the reason for this is that women and AFAB individuals were largely excluded from clinical trials until 1993, so about 30 years ago. It was actually illegal to recruit women into clinical trials. And if you're wondering why, it's because we had this patriarchal, outdated view that women have to always be protected. As the vessels of life, we couldn't have medications tested on us or new medical devices tested on us. But what this resulted in is a medical landscape where most of the pharmaceuticals, most of the medical devices, painkillers, antibiotics, antidepressants were never designed for nor tested on the female physiology. And because we never created the infrastructure to recruit women into clinical trials, we still don't do well with inviting women to participate in medical innovation. So this is a study on the female Viagra, which of course had to be pink. And it's from 2016. And as you will notice, it was safety tested in 25 patients. 92% of those patients for the female Viagra, which is not recommended for men, were in fact men. Another really prominent example of the gender health gap is the gap in disease diagnosis. So what you see on the screen is a study from 2019 from the University of Copenhagen. And keep in mind that Denmark has some of the highest levels of gender parity in the delivery of healthcare. Yet still, in 2019, in a country as progressive as Denmark, women got diagnosed later than men across 700 different diseases. So for cancer, for example, we have an average of a 4-year diagnostic delay. And for diabetes, we have an average of a 3-year diagnostic delay. And the reason for this is that the diagnostic criteria that we still use are designed to fit the male body. We recognize the symptoms of a heart attack in the male body, but we don't recognize them in the female body. And then if we narrow the disease diagnosis gap further to gynecological conditions, we see an even worse situation. Women largely avoid gynecological exams, and this has to do with their incredibly invasive nature. So think about 60% maybe of the people in the room, as I see you, who have met one of these devices before. And for the remainder of you, this is the speculum. The speculum is quite an outdated tool, actually originally designed in the times of the Roman Empire. And the golden version of it that you see on the screen is the one that was discovered in a volcano and, dates back to the times of the Roman Empire. The silver one that you see is still the one that we use today, again, in every gynecological exam. Only now we have a slight design upgrade, which is that it's available in plastic as well, not just metal. But as you can see, this is quite an invasive tool. About 70% of women report bleeding after a speculum exam, and as a result, women don't attend essential exams such as pap smears, which prevent cervical cancer. And another key example of the gender health gap is period and pelvic pain. Period and pelvic pain is a quiet public health pandemic. It affects 90% of the general female population, but we've normalized it extensively, even though we've known since 2016, which is when the study was published by University College London, that period pain can be as painful, as intense as experiencing a heart attack. Yet, again, in period pain, we not only have a treatment gap, we also have a diagnostics gap. And what you see on the screen now is a publicly funded study from Italy, which received grant funding and was then published in an independent peer-reviewed journal. And throughout this entire process, no one thought to themselves to question whether the study was necessary at all. So this study looked at whether women with endometriosis, which is a condition that causes extreme period pain, were deemed to be more attractive compared to women who didn't have endometriosis. And again, for the risk of repeating myself, this was a publicly funded study, which was then published in a peer-reviewed journal. So there was one group of people in one room who sat and decided, yes, we should invest taxpayer funding into this. And then another group of researchers, peer-reviewed scientists, thought to themselves, yes, this should be published. And if you're wondering what the criteria were for determining attractiveness, given that it is quite a subjective matter, the criteria were over-sexualized. So the women that were deemed to be attractive were women who had slimmer waists, larger breasts, and had become sexually active at an earlier age. So why is this happening? Why do we have such a severe gender health gap? And why are you only learning about this for the first time, guessing from some of the expressions that I'm seeing? The gender health gap actually starts before we can even conduct a clinical trial with humans. Researchers today prefer to use male mice over female mice. So even before we have a new compound that is selected for human clinical trials, there's still a gender health gap there. And if you're wondering why, it's because we're very afraid of the menstrual cycle. The menstrual cycle of female mice is seen as, quote unquote, a pollutant of the data, instead of what it actually is, which is one of the many factors that you have to control for when you're developing a new device. And another key reason for the deep and pervasive gender health gap is the utter lack of funding for innovation. It is a complete disaster, the level of funding that goes into women's health. So this is the statistics from the NIH. The NIH is the American body that funds clinical innovation, and through the NIH, we develop most of the innovation that then gets used in Europe and the UK. And the NIH spends about 2.5% of its entire budget for healthcare innovation on women. So that 2.5% has to stretch and cover breast cancer, cervical cancer, endometriosis, menopause, fertility, the entire spectrum of the female health experience. And in Europe, it's actually worse. Germany spends about 0.9% of its public innovation funding on women's health. The UK spends about 2.3% of its budget. So we really are not allocating sufficient funding in order to start finding some of the answers that we need for women's health. And within the private investment landscape, it's an even more dire situation. Less than 1% of venture capital that goes towards medical innovation gets invested into women's health. And then if you're a female founder, it's incredibly challenging to attract funding. Currently, only about 2.3% of the whole global pool of venture capital goes to female founders. And the reason why this is important, we need more women to develop the innovation that will then be utilized by other women. So on to less depressing subject matters. I also wanted to introduce you to the work that my organization, DAY, has been has been undertaking for the past 8 years. We want to put an end to the era of just deal with it, just grit your teeth and get on with your day. And we want to create the tools that we need in order to enable the first ever generation of truly healthy women. Because we currently still rely on the tools that our great grandmothers and grandmothers utilized, even though we live in a very, very different world. So in 2017 is when I started my company. I was 22, turning 23, and incredibly naive. So I'm very, very grateful for the naivete that I had at that time. I certainly wouldn't have started this company if I knew what was to come. And I faced the gender funding gap myself firsthand. Most frequently, I was asked whether this could be a real business or whether it's an NGO. So I actually utilized a bunch of credit cards and my salary to fund the company for the first 2 years, which enabled me to complete clinical trials and file for IP, and eventually in 2019 raise funding from private and public investors. And what we raised the funding for was to redesign the menstrual tampon. The menstrual tampon is one of the most commonly used devices. About 90% of women utilize menstrual tampons on a regular basis or part-time. Yet menstrual tampons are one of the last greatly monopolized industries out there. Whether you're one of the large brands or the smaller brands, everyone manufactures in the same facility, using the same machines, which is why we haven't seen any meaningful innovation in this very popular consumer category. So we decided to invest some of our funding in building an in-house manufacturing facility and redesign the tampon from scratch. So we created a better menstrual health tampon. And next, we took the tampon innovation even further. So instead of asking the patient to adopt an entirely new device, we tapped into an existing customer behavior using tampons and made the tampon more valuable. So we invented and commercialized the world's first pain-relieving tampon, a localized solution for period and pelvic pain, which has been now through randomized controlled clinical trials. It has helped over 100,000 patients in the UK and the EU. And we have demonstrated that it works faster than painkillers with fewer side effects. And importantly, it works for a bigger percentage of the general population. And through the experience of introducing the pain-relieving tampon, we realized that our patients suffered not only from not having options for treating their period pain, but they also had a lot of questions on what was causing their period and pelvic pain. And conditions like endometriosis, adenomyosis, polycystic ovarian syndrome, they cause period pain and affect about 1 in 6 women. Yet frequently we see huge diagnostic delays. So we see anywhere between 7 and 10 years, 8 to 12 years for a patient to be diagnosed with the root cause of their period pain. So we want to create a solution for this, which is the Period and Pelvic Pain Clinic, a new digital-first way for the patient's symptoms to be matched to a diagnosis, significantly speeding up the time to finding answers on the real causes of a person's period pain. And then in 2023, we finalized our product innovation cycle by introducing the world's first diagnostic tampon. If you remember the speculum from a few slides ago, this is a replacement for the speculum, a way for people to get tested for STIs, vaginal infections, and the HPV strains, which cause cervical cancer, all from the comfort of their home without needing to have an invasive pelvic exam. And last year, with the diagnostic tampon, we started working with the National Health Service. We have now supported over 11,000 patients, again, on their journey, not just towards treatment, but towards diagnosis as well. And so far, we have expanded across the EU, UK, and US. Last year, we were also named as the Time Invention of the Year. So now we're looking to the future. We're looking to scale the access of our solutions and our innovation. And we're not only focused on countries that are economically advanced. Recently, we completed clinical trials in Tanzania. We're now starting a clinical trial in Nigeria, where the burden of cervical cancer is highest, ensuring that our innovation makes an impact not just for those who can afford alternative healthcare options, but for those who really suffer the pain of some of these chronic gynecological health conditions. And another key focus of our work is sustainability. We don't believe that innovation should cost the earth. So beyond designing new medical and diagnostic devices, we also invest a lot in material science innovation. So our menstrual tampons are made from cottonized industrial hemp fibers instead of from petrol-derived plastics. Our applicators for the diagnostic, the pain relieving, the menstrual tampons are made from biodegradable materials instead of, again, petrol-derived plastics. And our packaging is fully water soluble as well. So you can just flush it down the toilet after you finished using the product. So I'm very excited to be standing in front of you today and to have the opportunity to share a bit of their story with you. Going forward, we are fully committed to helping bridge the gender care gap and the gender research gap, and to do so across the world. So thank you so much for taking the time to recognize the gender health gap. I hope you will have taken some of these facts and you will take them forward at dinner parties and you will discuss them with your friends, because we all need to be advocates for better women's health. If we don't have healthy women, we're not going to be able to have healthy societies or healthy economies. If you think about the state of women today, we graduate from universities at higher rates than men. We also tend to be better compensated than men up until our first child, and then things deteriorate. So we have this incredibly capable part of society that is currently stuck at home with a hot water bottle over our tummies, or we drop out at the peak of our career due to unmanaged menopause symptoms. We can't afford to let go of this incredible economic and societal potential. So if there's one thing that you take away, really please remember that women's health is a global issue. It is not a feminist issue. It's a societal and economic issue. Thank you so much.
Thank you, Valentina. Please stay on stage for a couple of more minutes. Valentina, I heard you last year at the Global Innovation Forum in London.
Oh, cool.
And I was then really very impressed about what you were doing. And now hearing you telling again what you were doing more in detail, it's really very extraordinary. And what I was wondering is, there are, of course, a lot of bigger companies earning a lot of money in women's health. How are they looking at what you're doing? Do they want to collaborate, or how does it work?
Well, we do see larger companies in the women's health space, but there are very few who are specialized in women's health. You see now Organon, for example, has specialized. They spun out from Merck. Hologic traditionally have been specialized in women's health. But still, even though there's larger companies, they rarely have that specialism into women's health. Women tend to get what I call hand-me-down innovation, something that was developed for male patients or for another patient group, and then it's simply repurposed for a gynecological health use case. I personally believe that we should all be working together. I have absolutely no reservations about working with small or large companies. We publish all of our patents transparently on our website, all of our lab testing technologies, all of our supply chain and manufacturing technologies on our website, because we want the standard to be lifted for everyone. We want to create industry-wide change. And I mean, my investors wouldn't be too happy if they heard this, but I don't care if they is successful or if another company in the space is successful. We just need to not hand this challenge over to yet another generation yet again. I don't have children yet, but I don't imagine myself feeling comfortable with looking my children in the eyes one day and saying, oh, sorry, I tried my best, but maybe you give it a go.
Yeah, and as a father of two daughters, I can always support that, Valentina. Valentina, what is your absolute moonshot when you look like 5 or maybe 10 years further?
Well, now it's a very interesting time for the company, because we have delivered on the entirety of the original vision. So it took me so many years to figure out manufacturing, product design, regulations, to actually bring all of these products, which were ideas in my mind or they were experiments on my kitchen table, to actual human patients. So now for us, it's all about ensuring that as many people who need our products and services have access to them. So we started working with US insurance companies to make the products insurance-free reimbursable with the British National Health Service, so it can make them available free of charge to patients. And again, a really big part of our vision is to ensure that we can make an impact in sub-Saharan Africa in particular, where the burden of gynecological cancers like cervical cancer is huge. Again, I know my presentation was somewhat depressing, but one of the most exciting things in women's health today is that we can eradicate cervical cancer by 2040. We have the technology to do it, and this isn't like a founder dreaming like future possibilities. It's very, very possible with advanced self-sampling technologies for HPV, with HPV vaccinations. And I think that's so exciting because cervical cancer is the deadliest female cancer on a global level.
Thank you. We are in Belgium. Are you doing business in Belgium, or do you have partners in Belgium already?
Yes, we are available in Belgium through our website.
Okay, this through the website? Mm-hmm. Okay, so follow Valentina, follow Day, and if you want to collaborate with her or support her in her mission, please get in touch with her.
Thank you. Thank you so much.